moment. First, H&N investigates an added strain on healthcare. We've learned Central Oahu's only public hospital will soon pause all inpatient services.
This as most facilities are already congested. As our Allison Blair explains, this means longer drives for patients and longer wait times for ambulances.
Come spring, all inpatient services at Wahiawa General Hospital will be suspended once the Queens Health System takes control of the hospital. The reason, health officials say the aging facility is in such disrepair, it's not worth investing the money to fix. While inpatient services at Wahiawa General Hospital are expected to cease by April, the facility's emergency room will continue to operate, making it the only freestanding ER in the state. A change that will bring with it a new set of challenges for Oahu's already fragile healthcare system. In addition to the loss of 53 licensed inpatient hospital beds, people in Central Oahu will be forced to travel farther to receive inpatient care, often to facilities that are already bursting at the seams. And before anyone can be admitted to those hospitals, they must be evaluated in their emergency room.
Our emergency rooms, especially on the west side, have been very busy.
Last week, Monday, the Queens West ER was at 268% of capacity,
which means that they have 2.5 patients basically for every bed.
While everyone is receiving care,
there's not enough beds, so they'd be sitting in chairs or in gurneys as they're waited to be processed through the system.
Rathel says Queens Punch Bowl, Polimomi, and Straub are also dealing with similar situations in their emergency rooms, either operating extremely full or over capacity. In the event you do wind up at Wahiawa General's emergency room after its inpatient services are terminated and a doctor determines you need to be admitted,
then they'll need to be transported via ambulance to another facility.
So kind of an extra step.
Well, it is an extra step, and it means that you're tying up an ambulance.
While AMR is responsible for most interfacility transfers, when the provider gets too busy, it's up to EMS to take on the additional load. Officials say a single transfer can take an ambulance out of its primary response area between 1 and 2 hours.
This does directly translate to longer wait times.
A definite cause for concern, especially in an emergency when every second counts. And this is something that could last for years.
Yes.
Rathel says any long-term solutions are still a minimum of 2 years away. He says the Queens Health System is currently trying to decide if it wants to build a new inpatient facility in Wahiawa or add an extra floor to the planned expansion at Queens West. We'll continue to follow this story and provide updates as soon as they become available. Allison Blair, Hawaii News Now.